recovery seemed so scary and so far away. There were moments where I couldn't see my child anymore.
The statistics are just mind-boggling. Rates of suicide have just gone up astronomically, especially in the population of ages 10 to 24. This is one of the first programs for children and adolescents in mood and anxiety residential level of care in the country. Children and teens have such rich minds and emotions. Lots of them struggle to get that out. Once they start opening up and realizing that there's safety in communicating, that's when change can really start happening.
Kids need to know you care before they care what you know. These kids benefit from our program, and it's so important to have this space. We're able to serve two different types of populations, so we're able to serve kids on our mood and anxiety side and program them and tailor their needs. On the other side, we're able to serve our eating disorder population and tailor their programming to their needs.
We will have the capacity to treat a variety of kids that can really get at what underlies some of the symptoms as opposed to just the symptoms.
There was not one bed for the treatment of eating disorders in the city of Chicago, and got inspired to make a change. Started with teaching people the skills that they needed to recover from their eating disorders. Part of my passion was bringing it to the community that they live in, which is also why I'm so excited about Northbrook, because it's here, and this is their community.
Family is the arena of recovery. We have their child for a month, maybe 2 months, where this family has the child for a lifetime. And so really the work is empowering the parents. So rather than sending them to the experts, feeling like an expert again in their own parenting skills. So that's super important.
These are big decisions, and you want to make sure you're doing the right thing. And I think for us to be able to do an intensive evaluation, an assessment of what's going on, looking at the emotional, the psychological, the medical, the psychiatric, and really putting a team together to look at the whole child and the family system and kind of put our heads together and say, here's what we think is going on, and here's where we think we need to intervene. In the last 10 years, just the rise of DBT and ACT and cognitive behavioral therapy and the evidence-based treatments that we're using today, I think it's almost like going to school. So they're coming to our treatment centers, but now we're going to involve the families and the patients to learn the skills that we have so that they can use them when they're at home as well.
In Northbrook, our residential will be a multidisciplinary team, so that'll include a psychiatrist to do a full assessment to determine appropriate diagnosis. In addition, they'll have an opportunity to have an individual therapist and family therapist. So with that individual therapist, they're learning skills, they're learning how to express emotion in a healthy way. For our eating disorder patients, they'll also have a dietitian on their team. That'll be a lot of work done with the family as well, so that the family understands, how do I feed my child when they return?
No matter where somebody is in the cycle of their mental illness or their eating disorder, we can meet them where they're at.
Everything you guys do every day and the effort and work you put in matters. It's life-changing, and I don't know if my daughter would be here without all of you and everything that you do. Thank you very much.